quarantine for their whole infectious period. 8 remain under investigation, and of the remaining 15, 7 spent some time in community for at least part of their infectious period. To 8 p.m. last night, we have 10 people in our hospitals. 3 of these are in ICU and are all requiring ventilation. The age range of our ICU patients is from their 30s to 60s. So of the 10, 7 are unvaccinated, 2 have received 1 dose and 1 is fully vaccinated. Neither of those 3 patients in ICU, none of them are fully vaccinated. Of the total 10 in hospital, our youngest patient is in their 30s and the oldest is in their 90s. There are currently 14 cases linked to Calvary Hayden Aged Care Facility. This includes 10 residents, 3 staff and 1 household contact. I am aware of 2 additional cases that have been notified overnight that are not in today's numbers. Calvary Hayden are currently communicating directly with those affected, and we can talk to these cases in tomorrow's update. So I'm going to give you a broader update on the outbreak. And this, I guess I have the privilege today in Karen's absence to give you the more detailed weekly update. So since the 12th of August 2021, there have now been a total of 804 cases in the ACT. Unfortunately, as you know, this week we sadly saw our first death in this particular outbreak in a confirmed case. So this case was linked to the outbreak in an aged care facility, and our condolences are with that family. For the last month, the average daily cases has been 17.6, and the average per day for the entire outbreak is 17.1. So it's remained steady with some variance. Over half of the cases seems to be continue to be male, and the median age of cases is 26 to 28 years. The average cases notified per week is now 123, with 32 cases still being the highest number notified on a single day during this outbreak. We are still seeing a larger number than we would like in people delaying getting tested, and the Chief Minister just talked to this. Ideally, we would want to see people getting tested as soon as any symptoms developed, or even better than that, tested pre-symptom onset in quarantine if they're an identified close contact. But our analysis is telling us that the proportion of cases waiting 2 or more days from developing symptoms to get tested is around 40%, which is far too high. I'm sure you'll all agree, especially as we are considering our pathway forward. The proportion of cases that are waiting 5 or more days is 10%. That's 1 in 10 of the cases. And as the Chief Health Officer mentioned yesterday, this is very concerning. So please be vigilant in getting tested. We now have approximately 88 cases where the source is unknown or remains a mystery. Again, in this week's report, over half of them have been notified in the last 2 weeks. As you know, these mystery cases suggest unidentified chains of transmission and community transmission, and this increases the risk to all of us, especially for our most vulnerable groups. As we've said previously, this is where our public health social measures come into play in restricting that movement around the community when we know we have unidentified cases. So Canberra's done a fantastic job with these measures so far. And this has really heavily contributed to our ability to cautiously ease out of lockdown. So please continue to be mindful that even with the easing of restrictions over the coming weeks, it's still so very important to maintain those COVID-safe behaviours that we're also used to now. We have now 32 separate clusters identified since the onset of this outbreak, 12th August 2021, with an average of 16 cases per cluster and a range of 2 to 52 cases in each of these. To date, there's been multiple separate introductions of the COVID-19 Delta variant into the ACT, and I think the Chief Health Officer has talked at quite some length about this. As per last week's report, at least 2 of these introductions have resulted in significant community transmission. So as you can see, while our daily case numbers go up and down, when we consider the average across the entire outbreak, they are staying steady. They're not rapidly escalating, which is giving us the confidence that we need to be able to move forward once we meet our vaccination goals, as outlined in the pathway. We'll continue to analyse the data in this outbreak and any new cases to ensure that we can maintain that confidence at the scheduled intervals, and importantly, to ensure that our healthcare system can continue to provide the highest quality of care to both COVID-19 and other patients. My shout out today is to the local general practitioners and the nurses and reception staff and administration staff in their practices. They have been working absolutely tirelessly in the last 18 months to continue to deliver not only their usual primary health care in a COVID-safe way, but also the care to their patients who test positive. And this has not been without its challenges, as you can imagine. They have provided countless explanations and reassurances about COVID prevention, in particular for people who have ongoing medical conditions that put them at risk for severe disease. They are key partners to the government in the vaccination rollout and have done an amazing job getting many people, not only their own patients but others, turning up to their practices vaccinated in our community throughout the year, and they continue to do this and will continue to do this into the future. Of particular note, our GPs have also provided really valuable support to our retirement and our aged care facilities and to our COVID care at home teams. So I really want to thank them for their commitment to their patients and to the community. Thank you.
Thank you, Dr. Johnson. Happy to take questions.
Chief Minister, I was just hoping to get a bit more of a response from you about Joss Frydenberg's announcement today about those COVID disaster payments. Did it come as a surprise to you? Do you feel like it's a fair response from the Commonwealth?
Well, it didn't come as a surprise. I knew that they were going to have to say something. I think it was important that there was a tapering down, that the payments weren't immediately cut off. I think, based on the trajectory of our vaccination rollout, that it will, as I mentioned in my opening remarks, align with the pathway forward that we've outlined. So the additional weeks of payment will ensure that the month of October is covered. And then, obviously, our restrictions take a much more significant easing point from the 29th of October. So we'd see a lot of people return to work at that point. There will, of course, still be a safety net for people who can't return to work in the month of November, and they will continue to be supported by Commonwealth income support.
The Treasurer made it very clear that the whole point is to stop state and territory leaders from imposing lockdowns on their communities. He wants to avoid that going forward. I guess, how will that alter your decision-making, given that we don't know exactly how this is all going to unfold as we ease?
Well, it would have no bearing on public health decision-making, and given New South Wales, ACT and Victoria had all released their pathway forward before this decision was taken, I think that that spin that I see certain sections of the media are putting on this announcement is just that, political spin.
Just on those, the business support grants, we've heard businesses say that without the income support for staff, they actually won't be able to bring them back because there's not enough cash flow in the business. We are seeing over the Christmas period, December, January, is when a lot of hospitality staff take annual leave as well. Given that the ACT, the remit, of small businesses is the ACT, and income support is federal. Once we cut one of those off, are we going to see a large drop-off in employees being able to work, or hours being cut for casuals such as the likes, while while restrictions remain in place for hospitality, restaurants, cafes, venues?
That may be the case for a period of a few weeks. It will depend a lot on the size of the labour market and the available staff. I mean, I suspect what's likely to happen is that the absence, for example, of international students and domestic students who would otherwise supplement the ACT labour market will in fact mean that businesses are more likely to have skill shortages and lack of staff than they are not having enough staff.
So given this announcement is after the business support you spoke about on Monday, does any of that have to be reworked or looked at or increased, considering that we are now going to see workers, especially casual workers, impacted by this decision?
Well, I think I've addressed that in my opening remarks in that we have reached in-principle agreement, and as I said yesterday and have said repeatedly, there will be a narrower range of industry sectors, hospitality being one of them, that will need ongoing support beyond the end of the lockdown. And so that this intersection of those issues that you touched on, Dom, were the subject of the discussions with the Commonwealth Treasurer, and particularly as it relates to businesses that have a larger number of employees. And so there's a package of support that we've negotiated with the Commonwealth for that narrower range of industries that we'll be announcing jointly in the next 24 hours.
Could I please ask, did you ask the Commonwealth for a longer period of income support to cover those few weeks where businesses are allowed to trade, but we can expect they would be much reduced hours of work?
Yes. So that was a feature of our discussion. Ultimately, we're not jointly funding the COVID disaster payments, so that's an entirely Commonwealth-funded program, so is entirely within their purview to determine at what level and how it's tapered and all of the rest. We put a case to them that there would be a need to taper and that there would still be people who would need support in the transition phase. And so to the extent that their announcement addresses that, either partially or fully, will be, I guess, in the eye of the beholder, Paul. What I would observe is it's not as if there'll be no income support. So it transitions down, and then if someone finds themselves without any work, then there is, of course, the usual safety net of Commonwealth income support in that circumstance.
And could I please ask, what details are still to be negotiated after the in-principle agreement on business support?
So we're talking about turnover threshold and payment quantums for businesses above baseline. It's nearly all finalised and we'll have an announcement, a joint announcement, I imagine, in the next 12 to 18 hours.
Chief Minister, with that tapering off and then also the time taken for the ACT economy to start to recover and things like that, how concerned are you that will overburden ACT welfare and support services?
Well, we obviously have ongoing programs that factored in support at least until the end of this calendar year and often into the first quarter of 2022. I expect that as we make our way through and navigate our way through the next few months, that if there is a need to provide additional support, either at the Commonwealth level, jointly between Commonwealth and states and territories, or by state and territory governments, as we're going into a period of some uncertainty, we just don't know exactly what will happen as things open up. We'll be able to adjust policy settings if it's necessary.
Chief Minister, I appreciate you touched upon this yesterday. With regards to New South Wales regional travel, they've updated their roadmap pathway, whatever you want to call it, to 80%, which is due in about 3 weeks, roughly within days of the ACT reaching that. There will be unlimited vaccinated travel across all of regional New South Wales. What's going to happen with people travelling to, say, Queanbeyan and Yass? Are we going to accept New South Wales residents? Are we going to open up? Or can ACT residents go and see family in Queanbeyan? Are we not going to be able to police that?
There's about 8 questions in all of that. That was all coming at me at a rate of knots. So The ACT is currently listed as an COVID-affected area under the New South Wales Health COVID Concerns Notice. So this is the sort of formal arrangement that they have. What this means is that you must complete a travel declaration within 24 hours immediately before entering New South Wales, and you must follow the rules that New South Wales have in place for interstate travellers. Now, we have negotiated a Canberra region arrangement to give standing exemptions for travel across the border within certain postcodes immediately outside of the ACT, and there's an accepted list of reasons for that travel. Between now and when our lockdown ends, all of that stays the same. There will then be a 2-week period between 15 October and when New South Wales are anticipated to reach their 80% vaccination threshold, in which they then say that vaccinated people will be able to travel more freely around New South Wales. My presumption is that vaccinated people will include ACT residents and that New South Wales would alter their affected area declaration for the ACT to then draw a distinction between vaccinated ACT residents and unvaccinated ACT residents in terms of who would be allowed to travel into New South Wales. Now, my hope is that the Canberra region that we've established with the postcodes will not have a vaccination check back and forth. So to answer the specific question on could you go to Queanbeyan or that, I would hope that they won't link that to vaccination status and will be able to have in that 2-week period and at the end of October a reasonably free movement across the border as per our standing exemption arrangements. But if you wanted to go further than those identified postcodes, you would need to be vaccinated, is my understanding of the New South Wales rules. How they are going to enforce that, I don't know. That then puts in place a set of interesting quandaries for us about New South Wales residents outside of the defined Canberra region postcodes wanting to come into the ACT in that 2-week period. Now, clearly they would be travelling through part of New South Wales, so to meet the New South Wales requirements, they would need to be vaccinated. So I think for the purposes of consistency, although we will confirm this once we've concluded our discussions with New South Wales on how all of this is going to work in the 2-week period and then potentially in the month of November, we would mirror New South Wales arrangements. So I think the best advice I can give today, because this hasn't been concluded yet, is that if you are unvaccinated, your travel is going to be more limited than if you are vaccinated. What I don't know the answer to is what New South Wales will do and how they will treat people who have 1 dose of a vaccine, how they will treat people who might have a booking for a 2nd dose. I don't know. We'll need to get some clarity, and this might be a question that you all might wish to ask the New South Wales government. Because what this is going to mean in practical terms is that the people who haven't yet had the opportunity to have 2 doses are principally under 40 years of age. And I don't know how New South Wales are going to treat unvaccinated children under 12. I'm not necessarily sure how they're going to treat children aged between 12 and 15, many of whom will have had 1 dose in this period by the 2 weeks at the end of October and then the 4 weeks of November before I think everything normalises and gets a whole lot easier and less complicated after 1 December. So sorry, that's a long answer to about 8 different questions you asked me, but does that clarify?
Yes, and just one further question. On the flip side, with the ACT, those people returning from outside of those postcodes, what's the quarantine requirements going to be for, is there going to be a separation of vaccinated and unvaccinated individuals? And will that be tied to New South Wales vaccination rates, given that their community transmission will be a lot higher and is unlikely to come back down?
Yes, they're all good questions. We haven't yet concluded our thinking on those points. But again, the principles will be around identified hotspots, because what we might be dealing with in New South Wales is that in some local government areas, they have got vaccination rates, with a 9 in front of them, 90% or more, and they won't be areas of concern identified by the New South Wales government. But it could be that certain local government areas where vaccination rates are lower are in lockdown. in October and November. New South Wales have not ruled out that occurring, and almost every day there's a new local government area that's put into lockdown. So I think for ease of understanding, our approach has generally been that if New South Wales declares an area a hotspot and locks it down, then that puts travel restrictions on people coming from that area or going to that area. But I just do not know at this point exactly how they are going to deal with that and whether they're going to draw a distinction between vaccinated and unvaccinated. But at the highest level, it would be worth observing that you're going to have more freedom of movement if you are vaccinated. Whether that is entirely free or not will depend on decisions that New South Wales make. From our perspective on requiring quarantine when people come back in, it would be logical to draw a distinction between vaccinated and unvaccinated people as to potentially both the duration of quarantine and the location of quarantine. So a risk-based approach is likely to be applied. But we haven't yet concluded all of our deliberations on that point, and we do want to talk to New South Wales so that if it's possible to have a consistent approach between the two jurisdictions, I understand that would make life easier for everyone and mean that I could give shorter answers to complex questions at press conferences.
Just on business support again, the imposition of restrictions is going to be with us for a fairly significant period of time. They'll be eased significantly, but there will be some businesses who can't operate
at full capacity,
at 100% capacity like they could.
Yep.
Does there come a point where the ACT government says this business needs to simply adapt to new conditions, or will there be support for that entire period until restrictions are a thing of the past?
I think it depends on the level of restriction and the impact on business. I mean, we have some pretty well-established thresholds now around eligibility for assistance at a 30% turnover decline. So I think it would be unrealistic to expect that, if your business was down 5%, that the taxpayer is going to come in and address that 5% shortfall. But if the shortfall is more than 30%, then you would continue to be eligible and receive assistance. But clearly, we are entering into a phase where support is going to start to be tapered, both in the number of businesses that will be eligible and the range of industry sectors. So, for example, construction has been back at work for many, many weeks now, and so I don't think construction will need ongoing economic support, except for perhaps for a very narrow band. But beyond that, we know retail will be back at 1 per 4 square metres at the end of October. So that would start to signal a transition point for retail, but you obviously still have some ongoing economic support through the month of October. But high-risk hospitality isn't currently slated to open anywhere until December, and that's nightclubs in particular. And so if you're completely closed, then yes, you're going to continue to get support. If your business is significantly impacted, yes, you're going to continue to get support. If your turnover is down 5 or 10%, no, you wouldn't be beyond the lockdown period.
You've given a sense in recent days that there might be something brewing between the ACT and the Commonwealth on the vaccine front. Is there anything to announce as far as securing supply goes?
We I think, are better placed. I'm expecting some further information to come to Friday's National Cabinet meeting that would enable us to make some final adjustments to what I hope will be the final month of the mass vaccination program. As I said in my opening remarks, I think we've got about 45,000 first doses sort of potentially still to do, and given the vaccine take-up in the ACT is the highest in the nation, it's not a question of hesitancy, it's just a question of supply. And so then there's a few areas where we understand that a little bit more certainty and an earlier booking would make a difference. So I am very focused on getting as many people with at least a first dose by that 15 October date. And so we'll have a real emphasis on that. So that means particularly if you sort of look at the vaccination data, and he pulls that out now, We've only got 42% of 12 to 15-year-olds with the first dose at the moment, 67% of 16 to 19-year-olds. So you see the Year 12 program coming in there. We've got 63% of 20 to 24-year-olds with the first dose, 78% of 25 to 29-year-olds, 84% of 30 to 34-year-olds, and 87% of 35 to 39-year-olds. Everyone over 40 has a first dose rate that is either 95% or above. So what that shows you is the really strong vaccination take-up. An interesting quirk that we have found, and this will require a small amount of adjustment to the denominator for the ACT, is that we have issued 41,850 first doses to people 70 years and over in the ACT. The Commonwealth believe we have only 39,946 people who are of that age. So clearly our vaccination program is more accurate than the ABS estimated residential population, because we have apparently vaccinated 105% of our 70-plus population. So that is a small statistical anomaly that needs to be corrected, which means that the denominator, the number of ACT residents, is slightly more than the population that the Commonwealth have been projecting. It's at the margins, but nevertheless, when everything is hinging on 70, 80 and all of these thresholds, it's important that these statistics are accurate, and that is clearly an anomaly. Our population in that age group is obviously higher than the estimated residential population. We are also about to cross over the having vaccinated 100% of our 50-plus population, which tells you that there is also an error in the ABS data in relation to the number of Canberrans aged 50 years and over. Now, these things are at the margin. They're several thousand people, but to put this in perspective, for every 1,000 people that you vaccinate, that is probably means 100 less hospitalisations and 10 fewer people in intensive care. So every vaccination counts, and this is important for us in a population of 435,000 to vaccinate as many people as we can.
Will it impact our ability to beat New South Wales in the vaccination race?
Well, I suspect that there might be a few errors in the estimated residential population. I mean, the baseline that all of this has been drawn on is June 2020 estimates. So it's already more than a year and a quarter out of date. So it probably wouldn't hurt for the June 2021 data to be used as the baseline. It's only going to shift things by, probably there's 100,000 more Australians. But what it does clearly show is that the internal distributions, there's more Canberrans than the ABS thought there were.
The Vaccine Horizons document released on Friday showed that the amount of Pfizer coming into the country is increasing in October, but the amount allocated to states and territories is decreasing. But John Fruin has said that on Friday the issue was all fixed. So could I ask, was the problem that some of the Pfizer was coming so late in October that it couldn't be allocated to states and territories? And what is the certainty you're expecting to get on Friday?
Sure. That's one of the issues. I think the other is that across the states and territories there's a different balance between state and territory administered vaccinations and that is administered through the Commonwealth primary care networks of GPs and pharmacists. So I'm sure you follow this, Paul, but each week they provide an update on the allocation efficiency of each state and territory in terms of the number of doses that have been allocated to that state and territory and how many have been administered by each state and territory government. Now, the ACT is the national leader in efficiency with zero wastage. And in fact, our teams have been so efficient in the delivery of Pfizer. You'd be aware that they come in vials that allow, with expert extraction from those vials, the Commonwealth base it on being able to get 6 doses per vial. Our nurses in our mass vaccination centres have been so good that they've often been able to extract a 7th dose out of those Pfizer vials. And so that is why we have the most efficient program in the nation for delivery of the Pfizer vaccine. So our argument to the Commonwealth was that we can deliver these vaccines more quickly through our mass vaccination hub, so we wanted the assurity of supply earlier because we have the nation's most efficient program. The other thing that I think has impacted the Commonwealth's thinking here is that they've not been as ambitious about their overall vaccination uptake. So there's been a lot of commentary and a lot of discussion about, most other countries have only got to 80% and then things have really slowed down. I can say with absolute confidence now that the ACT will get very close to 100%, closer than any other jurisdiction. So our argument has been, we're not slowing down. We've still got demand. If you give us the vaccines, we'll get them into people's arms. And the fundamental point that I have made throughout this is the more vaccinated Canberra is, the safer it will be for everyone. And so we're not seeing vaccine hesitancy. We don't have allocated Pfizer that's sitting there waiting for people to come forward. We have people with bookings and we're waiting for the Pfizer to arrive. And so that confluence of events is why we were concerned. And we have ambition beyond 80%. Obviously, we're already well in advance of 80% on first dose and we'll cross over 90% later this week. And then we'll get to 95. And then I think we'll get further. So we want the vaccines. We'll use them.
Chief, New South Wales and Victoria look likely to have home quarantine for 7 days for international arrivals once we hit 80%. Would the ACT consider a home quarantine system for returning Aussies transiting through those cities to Canberra?
Yes, in short, yes. I think that's the direction that it's heading. We just need to negotiate the transit arrangements from the port of arrival and how that would be done onto the ACT as to whether that would be a connecting flight or road transport. Clearly, international travel will be for vaccinated people only. So, again, that's sort of a reduced risk factor there. But, yes, I think that's the direction we're heading.
Chief Minister, you gave Canberra parents a clear pathway out of lockdown and back into classrooms. That came as a relief to many, but there's also certainly some concern among parents with children aged 12 and below about the lack of a vaccine mandate for teachers. Any movement on that as far as your opinion goes? Yeah, so we're currently surveying ACT teachers and the survey data shows a vaccination rate that's in the high 90s, so 98%, thereabouts. So that's as effective as a mandate. And what about in specialist schools? They're also being surveyed as part of that? Yes, absolutely, and they're at nearly 100%. Okay, and the safety measures to be put in place in specialist schools, are they any different to those in public schools? There'll be a higher level of caution in relation to those settings, clearly. There is sort of generally in terms of how those schools operate. And this may be one for the Deputy Chief Health Officer. Just what would happen if there was a positive case of COVID-19 in a primary school among those unvaccinated? Sure. I'll get Dr Johnston to deal with that. Are there any other questions for me? I do just have one more. One more, yes. Sorry. Today is Police Remembrance Day. How critical have the police been in managing this outbreak? And will there be a need, do you expect, for more ADF boots on ground once we ease restrictions? Well, look, ACT Policing have done an outstanding job, not just this year, but last year as well. And I think they've shown how community policing can be done in a really effective way. They've worked to educate the community, they've worked with the community, they've worked with business, they've worked in a number of different enforcement settings. The approach in the ACT is somewhat different from what you might see in some other states and territories. And I think Canberrans appreciate the difference in how our police force approaches its very important role of enforcing the law, but also keeping our community safe. And it's a credit to every single member of ACT Policing just how effectively they have policed the territory during this very challenging time. Thank you. Questions for Dr Johnston?
Hello.
Hi, Dr. Johnston. With those two cases at the Calvary Hayden, are you able to clarify today whether they're residents, whether they're aged care staff workers or close contacts?
I can't clarify that today because I'm not 100% sure that we haven't done all the appropriate notifications, but they'll be in tomorrow's numbers.
Just on the protocol, say we do get a positive COVID-19 case in a primary school where children under 12 won't be vaccinated, what happens then?
Yeah, well, we're assessing that at the moment. We're actually doing some work with Victoria and New South Wales, who are similar positions to us as having community transmission at the time that we open up and we get back to school. But we are looking at how our approach might be different in the context of having, vaccinated staff in a primary school and then in a secondary school, hopefully a high proportion of vaccinated students. So I can't tell you exactly how that's going to look. I think in the short term it will look pretty similar to how we do our contact tracing now, although we're putting in a lot of hard work with education in our schools to try and reduce the mixing and mingling and trying to get students and staff cohorted to using shared facilities. So we're trying to reduce the impact, I guess, on other students and staff being identified as either casual or close contacts. But then you overlay vaccination on top of that, and the risk profile changes quite a lot with all of those measures. So we really have to look at what sort of test, trace, isolate, quarantine looks like in that setting. And as I said, that they're national discussions that are underway. So I can't step you through that specifically, except to say it will look different in coming months.
And may I also just ask, when you went about making the decisions and you formulated this plan to return students back to the classroom, how did you balance the risk of COVID-19 getting into a school setting where there are unvaccinated students with the need for them to get back to school and get back to that socialisation? Yeah.
Well, I think Minister Barry highlighted in the announcement on Tuesday that the safety of the school community, particularly the students for whom there is, this duty of care, was the most paramount decision. And I think the Directorate went above and beyond in surveying their school communities, their staff, about what were the drivers or what were their concerns, but also why did they want their kids to get back to school? Because the social and emotional well-being of the students is just so important, particularly in those transitional years and the foundational years. And we really saw from the Victorian data last year significant impacts on those children of having such a long time out of school. So we're in such a I just think we're in such a privileged position here to have such a high population vaccination coverage rate. And then with the additional, hierarchy of controls that we can put in place to keep students safe, I think we are doing this judiciously and cautiously. We're doing that for the whole community, and that aligns for our students and our teachers and our school communities. So all of those things were weighed up, but their safety was absolutely paramount.
Dr. Johnston, with this brief lag in people going to get tested, do you think that means we'll be seeing this roughly, 15 to 25-ish case numbers and number of those infected in the community round about the same until lockdown lifts, like no more 7 cases a day for us?
I think we'll consider, I wouldn't rule out the sub 10, we're always hoping for it, but I think we have that variance, but when we average it out, I can't imagine it will look much different over the weeks leading into lockdown lifting. So on any given day, I couldn't sort of predict what they'll be, but I think the average is going to be around the same.
What vaccination levels would the ACT reduce its focus on or eventually stop contact tracing?
Yeah, that's a good question. I think this is a discussion that's happening through HPPC and CDNA. I guess the issue with vaccinated individuals is that we know that there are breakthrough infections, and we know that a certain proportion, we don't exactly understand all of the science yet, will go on to transmit. It will be lower, but there is still risk to those most vulnerable who either can't get vaccinated or haven't. And then when the international borders open, we're going to be really still very alert to new variants. So we don't know how this virus may mutate. And if we have an indication of a new variant that's again more transmissible, but even more importantly more virulent or more severe, then we would also want to be undertaking very careful contact tracing. But contact tracing will look very different in terms of how it's done. As case numbers, we expect case numbers to increase, and who does it, and so and what it looks like for vaccinated and unvaccinated contacts. So that's all very live at this point, and we're putting those plans in place as well. And that will all filter into the national guidance and the guideline that we follow now as those decisions are made, and we'll continue to follow those national guidelines. Thank you.